Accelerating Nutrition Results, acronymed ANRiN, is a World Bank-funded, state-led, performance-based project. And Solina Health is one of the 2 NSAs implementing in Oyo State.
The ANRiN project started quite a while ago. About 3 years ago, we signed the documents with the 2 NSAs on the April 22nd, specifically for Solina and the other NSAs. The aim of the federal government and the World Bank was to reduce malnutrition, because one of the indices of malnutrition that was picked for every state was stunting, and Oyo State stunting rate was put at over 23%.
Join us as we embark on the captivating journey of ANRiN project and its success story in Oyo State.
So for us in Solina, the core of this project are based on 3 thematic areas, which is the service delivery, the monitoring and evaluation. We have a very robust monitoring and evaluation system, and also procurement and logistics.
We go to field to see our community volunteers in their ward, where we get to see what each of these CVs have on their register, comparing it with the other source. The other source include what they've uploaded on the app that we are seeing on the back end.
As soon as commodities arrive at the state store, we conduct what we call inspection to know what has been sent, if it tallies with proof of delivery. We do a spot check, confirming the expiry date, the batch numbers, and the likes. So all these are done before commodities are accepted into the store. So at this level, commodities are distributed to the 16 LGAs, where similar activities also take place.
Sì tún jẹ́ ọ̀kan nínú àwọn tí máa ń pín àwọn commodity fún àwọn ará àdúgbò tí à ń pè ní beneficiaries fún ìwúlò wọn. So a ní èyí tí a máa ń pín fún àwọn olóyún, a ní èyí tí a máa ń pín fún àwọn ọlọ́mọ wẹ́wẹ́ láti ọmọ òòjọ́ títí di ọmọ ọdún 5. So bákan náà a sì tún ní àwọn ilé tí a tún máa ń bá àwọn èèyàn sọ̀rọ̀ tí à ń pè ní lactating. So láti ọmọ òòjọ́ títí di oṣù 5 tí à ń ṣe ìdánilẹ́kọ̀ọ́ fún wọn lórí bí wọ́n ṣe máa fún àwọn ọmọ wọn ní ọyàn dáadáa.
Mo tún ní eléyìí náà, ORS ló wà nínú ẹ̀ àti zinc tablet pẹ̀lú ORS. Eléyìí àsìkò tọ́mọ wa bá ń yàgbẹ́ tàbó ń bì la lè lò. Tọ́mọ wa ò bá ti yàgbẹ́ tí ò sì bì ká má lò. Tó bá ń yàgbẹ́ ta fẹ́ lo omi inú ilé láti fi ṣe é fún, ẹ wá ike tó mọ́, ẹ jẹ́ kọ́wọ́ yín náà kó wà ní mímọ́. Ẹ rọ ike Pepsi méjì ńgbà tẹ́ ti ṣe omi yẹn tán lórí iná tó ti tutù, ike Pepsi méjì. Tó bá dẹ̀ jẹ́ pé pure water lẹ bá rí, ẹ ra pure water méjì. Ẹ tú sójú kan náà, ẹ da kíní yìí sínú ẹ̀. Iye aago tẹ́ bá pò fún lọ́sàn-án, bóyá bí aago 3 ọ̀sán ilẹ̀ rí pé ó ń yàgbẹ́, ẹ wá pò fún ní aago 3 ọ̀sán ìnìyẹn. Ẹ máa fún un lóòrèkóòrè di aago 3 ọ̀sán ọjọ́ kejì.
In order to achieve delivery of basic package of nutrition services, BPNS to target beneficiaries, Solina Health, a non-state actor, leveraged on existing government structures and efforts to close the distance barriers between the target population and the nearest health facility.
We can't overlook the support of our stakeholders too. Our NFP and our health educators, they helped us, they support us in recruiting community volunteers. They work hand in hand with our team leads to ensure that we recruit community volunteers.
As a nutrition focal person, so I participate in the counseling of the community volunteers. So because I used to speak with them, that the project they need to do, they will not go and sit down somewhere. They need to go into the community and help us look for pregnant women, go from one house to the other, and ensure that they submit their data, they document their work properly.
The involvement of different stakeholders is something that we have been clamoring to have in the states. We appreciate this, the approach that was adopted, because we are not just coming out to deliver the services, we are also reaching out to different stakeholders to have their buy-in in the project, so they are much more aware of what is going on in the states.
One of the key approaches we use is house to house. These CVs, they go from one house to the other just to locate these beneficiaries.
We engaged the community leaders, the community stakeholders, because if you are implementing any project in any community, you have to carry the stakeholders along. I'm talking about the gatekeepers. There are some people at the community levels that if you do not involve them in the implementation, I'm talking about, carrying them along with little details about the projects. The project might have a setback.
Ìpele méjì ló wà. Wọ́n ní ìpele fún àwọn ìyá, wọ́n sì ní ìpele fún àwọn ọmọ kéékèèké, ọmọ oṣù 6 títí di ọmọ ọdún 5. Àwọn nǹkan tá máa ń fún àwọn olóyún, a máa ń pè yẹn ní IFA, iron folic acid, tó jẹ́ pé tẹ́jẹ̀ ṣe ni, òun ló máa ń fa ẹ̀jẹ̀ sára olóyún. Ó tún dí àwọn èròjà tó yẹ káwọn olóyún ká máa rí jẹ nínú àwọn oúnjẹ tá à ń jẹ, ṣùgbọ́n tí kò kì í sí níbẹ̀. Wọ́n bá sì ń lo àwọn oògùn yìí, àwọn èròjà yẹn máa bọ́ sí ara wọn, yóò sì jẹ́ kí wọ́n máa ní ẹ̀jẹ̀ tó pé lé ara, kò sì ní jẹ́ ká rí ikú olóyún lọ́jọ́ ìkúnlẹ̀, kò ní jẹ́ ká rí ikú olóyún tí wọ́n bá ń bímọ lọ́wọ́.
Àwa tí a jẹ́ CV, oríṣiríṣi àwọn nǹkan la ní eléyìí tí a fi ń ṣiṣẹ́ yìí. So ara àwọn nǹkan tá à ń lò òun náà ni register, à ń lo register láti fi ṣe. So tá a bá gba orúkọ wọn sílẹ̀, a kọ sínú register. So a dẹ̀ tún ní káàdì pélébé tí à ń pè ní káàdì nutritional card tí à ń fún àwọn òbí, eléyìí táwọn náà máa mú dání tó máa jẹ́ àmì ìdánimọ̀ pé ìgbà báyìí la wá sọ́dọ̀ yín, tó fi jẹ́ pé tí a bá fẹ́ ṣe renew service, a ti kọ déètì ẹ̀ síbẹ̀ tí a fún àwọn òbí yẹn.
Another thing we do in this field verification is we do spot checks. We go to beneficiaries' house to see them, ask if they've used the service, the commodity given to them as they ought to.
Some beneficiaries shared their experiences with the ANRiN nutrition supplements and service delivery.
Mo gba iron folic acid nígbà tí mo wà nínú oyún. Mo dẹ̀ gba IPTP, oògùn ibà. Mo gba oògùn fún ọmọ tí mò ń tọ́ lọ́wọ́ náà. Mo gba MNP, albendazole, vitamin A àti zinc ORS. Ìgbà tí mo bí first born mi ò tí jẹ́ oní tó ń jẹ àǹfààní oògùn ANRiN nígbà náà. So ìgbà yẹn mo máa ń tutọ́ gan, ó dẹ̀ máa ń rẹ̀ mí gan, mo máa ń bì everyday. But ìgbà tí mo lo oògùn ANRiN nígbà tí mo bí second born yìí, mi ò tutọ́ rárá nínú oyún ẹ̀. Mi ò tutọ́, then ara mi máa ń gbé dáadáa ju ti tẹ́lẹ̀ lọ.
Mo jẹ́ kan lára àwọn tó jàǹfààní oògùn yìí. Lórí tí iléeṣẹ́ ANRiN gbé jáde fún àwọn aláboyún àti àwọn ọlọ́mọ. Wọ́n fún wa ní anti-malaria 3 ló wà nínú ẹ̀. A máa lò ní ẹ̀ẹ̀kan lóṣù. Àǹfààní tó ṣe fún wa pọ̀. Tá a bá lò, mo máa ń jẹ́ kí n jẹun dáadáa. So lóúnjẹ òwú mi jẹ gan máa jẹ. So ó wà òkè.
Mo gbọ́ nípa oògùn yẹn, mo dẹ̀ rí pé oògùn yẹn oògùn tó dára ni. Ìgbà tí mi ń sọ̀rọ̀ on behalf of my wife, ló lò ìgbà tó wà nínú oyún ló lo oògùn yẹn. So a dẹ̀ rí pé oògùn yẹn nígbà yẹn àbí ẹni pé torí tiwa náà ṣe oògùn yẹn ni. Ọmọ tá a fògùn yẹn bí sìn ẹ lè divine bóyá Nàìjíríà náà bí sí àbí lóyún, torí pé gbìrì ló ń yí, ó dẹ̀ ń dán láwọ̀. A ní access sí oògùn yẹn torí pé one of your staff mo mọ̀ wọ́n dáadáa. So tí bá ti dọ́dọ̀ wọn báyìí, tó bá ti tán à ń gbalé ọ̀dọ̀ wọn lọ nìyẹn. So a rí wọn bí nurse wa ní àdúgbò.
Bí àgbẹ̀bí wa ṣe fún wa ní oògùn yìí, ó fún wa ní okun, kò jẹ́ kí ó dènà ibà àti okun. Wọ́n sì fún wa ní ẹyọ kan láti lò lójúmọ́. 3 yìí ní oṣù, ẹ̀ẹ̀kan lóṣù. Àǹfààní rẹ̀ pọ̀ púpọ̀ lára wa, nítorí ẹ̀ náà láti wá dúpẹ́ fún yín pé iléeṣẹ́ yín ò ní jóná.
The Solina health team and other stakeholders shared some peculiar challenges, and the measures they employed to address these challenges.
One of the initial challenges we encountered was the recruitment of the community-based staff. Initially, we had a lot of attrition, and that was because we had so many community-based staff, and a lot of them were not really performing as we expected. So we had to do what we call weeding. So for those that are not performing, we had to ask them to quietly and respectfully leave the project, and we now recruited high-performing CVs, and these really helped us.
Some of them, they will tell the pregnant woman who tells you that she cannot talk to you except the husband comes around. The cultural barrier is that she cannot do anything without her husband's presence and consent. In up north there, I'm talking about Okyogun. There are rivers there. The roads are very, very bad. There were instances where our community volunteers were going to provide services at the community levels that they fell on by.
Challenges tí à ń tún máa ń face ni pé àwọn outreach area wa bí àwọn oko so kì í rọrùn fún ọ̀pọ̀lọpọ̀ CV láti lọ bẹ̀, but mo ní láti máa encourage wọn pé kí wọ́n jọ̀ so kí wọ́n lọ síbẹ̀. Problem tí wọ́n ń face ni pé power bank wọn at times ó lè má sí nọ́mbẹ̀ tí ò ní síná lórí fóònù, bẹ́ẹ̀ kò sí nǹkan tí mo máa ń bá wọn sọ ju pé kí wọ́n lọ charge ẹ̀ ní.
Where we go to the field, we go to the beneficiaries' house to verify if they actually got the service. We also face some very little challenges in the sense that we can get to now discover that the beneficiary has relocated and is no more living there. So usually at this point, what we just do is to get their neighbor, of course, to get the number of the person and to try to call the beneficiary to confirm the services.
There was a time that the app was down, and while the app was down, how do we get data from our CVs? We created a template, a tracker, of which our team leads used in assistance with the LGA leads, where we get data from our CVs and put them in place.
Torí pé àwọn tí wọ́n jẹ́ aṣojú yín nídò wọn kì í jẹ́ kí tiwa di gbogbo ètò tí bá ń lọ mẹ́yẹn ni wọ́n máa ń fi tó wa létí táwa náà máa kéde nígbà tá a bá ṣe sámà lọ́wọ́ fáwọn èèyàn pé àwa tí wọ́n sì ń jíṣẹ́ fún yìí àwọn náà lájòkó yìí wọ́n jíṣẹ́ yín bí ẹ̀ ti ń rán wọn gbogbo ń tẹ́lẹ̀ sí fi rán wọn sí wa ọdọ́dọ̀ wa o àwọn tẹ́lẹ̀ sí nìkan fún náà wọ́n ń gbà lọ́wọ́ wọn torí pé ẹnu wa ti síwájú káwọn tó débẹ̀.
ṣé rí community wọn fojú tó dára wò ó ṣe gẹ́gẹ́ bí bíbá yìí ààyè kò sí nǹkan tó bá ti lè mú wá tán bá ti ṣe nǹkan tó lè ṣàǹfààní fún wọn wọn ò fọwọ́ yẹpẹrẹ mú.
In our own community, they really accept ANRiN work, and it was embraced because it gives mothers to participate in their home care. It gives them the privilege.
We've heard stories of dedication, collaboration, gratitude, and positive change. The stakeholders of these projects shared their final thoughts on the journey so far.
I am actually eagerly waiting for maybe National Demographic Health Survey for the year 2023 so that we can see our indices. I am very sure that from where we started from, the record in 2018, I'm sure there will be significant improvements in the nutrition status of children in the state.
Yes, I'm glad to mention that, to be fair, Solina has really put the state in a high esteem because we can say that we've had 2 IFA, Independent Verification Agency, coming to the states to assess the states without the involvement of the state PIU. And to the glory of God, we can say that the 2 that we had, they made us proud.
The PPP, that's another thing that we are looking at, public-private partnership. It is very key because when you foster partnership, and you tell people that this is, at times people do not know, the implication of, malnutrition. They do not know. So you need to tell them. So when you tell them, you can see, you can get or leverage on people that own businesses, people that have foundations, philanthropies, all those, even corporate social responsibility initiatives.
Whatever project we are implementing at the community levels, let us all always remember that if it doesn't get to the actual people, the targeted beneficiaries, we are not doing anything.
I really appreciate the coordinator, the Solina, Oyo State government for remember people in my own village, in my own community, in fact, because this thing really reach those that are really needed it, and they make use of it.
We are the Paystater State on the ANRiN project because every woman, every child, adolescents, older women, lactating, pregnant, we make sure that they are served, and we leave no woman, we leave no child unserved on the ANRiN project.
Solina! ANRiN!